afternoon, everyone, and welcome. This is our 45th installment of the Stop COVID Deaths webinar series, and we are glad that you continue to join us in this learning journey as we continue to learn more about COVID-19. And today, we will continue with our understanding and also of more details as it comes out po in relation to the COVID-19 program, COVID-19 vaccine program rollout that is currently happening all around the country. So we have talked about the national vaccination roadmap, the vaccination rollout in our webinar series po, no? Pero we will delve into that program much more deeply in this webinar, and we hope that everyone will learn from our excellent panel of resource persons on essentially the implementations, what is happening on the ground, yung realities po ba na nangyayari. So I'm Dr. Raymond Sarmiento from the National Telehealth Center of the National Institutes of Health, University of the Philippines, Manila. It's always a pleasure for you to be able to join us today, March 19th, 2021. And as always, I'm very happy, I'm very pleased, I'm very honored and humbled that they get to share my hosting duties with my partner in crime and my mentor, who is also our adjunct research faculty at the National Telehealth Center, Dr. Susie Pineda Mercado. Dr. Susie?
Hi, Raymond, and hello, everyone. Good day, wherever you are, wherever you're watching. We'd like to welcome you to our regular webinar on Stop COVID Deaths. We're looking forward to an afternoon na marami na naman tayong matututunan. I'd like to greet everyone who's watching or with us in the webinar and those who are watching us on the playback. It's always a great opportunity for us to get together to talk a little bit more in depth about what's happening COVID-19. And babatiin ko lang lahat ng mga nakikinig sa iba-ibang bahagi ng Pilipinas, no? So mga taga Palawan, Davao, Zamboanga, Iloilo. I was just looking at the chat box and looking at where everyone is coming from, and truly it's a national effort to help our country respond to the COVID pandemic. So, welcome everyone. And Raymond, parang one year tayong, malapit na tayong mag 1 year, no? Parang ganyan.
Yes, it's actually, we celebrated, not really a celebration, no? Pero the 1 year anniversary of the very first time when we had our enhanced community quarantine. Ang iba lang po is that the vaccines have started to arrive, and we are hopefully and excitedly anticipating the arrival of the bulk of the COVID-19 vaccines in the next few weeks po. I'd like to greet just a few of our attendees po who are joining us internationally from Saitama, Japan, from Betaya, India. So mga bago po ito, no, na join sa ating webinar. Those from Bandung, Indonesia, Ho Chi Minh, Vietnam, Cebu, Malaysia, from Kyrgyzstan, from Doha, Qatar, Alcobar, Saudi Arabia, Luanda, Angola, Lexington, Virginia, Las Vegas, Nevada, Niagara Falls in Ontario, Canada, and from Pordenone, I'm sure if I'm pronouncing that correctly, in Italy. So maraming salamat po who are for those who are able to join us. And I'd like to take this opportunity po to greet and actually thank the very hardworking team behind the Stop COVID Deaths webinar series. Maraming salamat po. Kung wala po kayo, ay wala po itong learning series na every week ay nagsasama-sama po tayo. Over to you, Dr. Susie.
Yeah, you know, Raymond, I remember a year ago, I think was March 16 was the start of our enhanced community quarantine. And you know, at that time we really didn't know what we were dealing with. We had ban on flights. We had very limited testing. Our hospitals were crowded, I would say disorganized. We didn't have PPE. We didn't know what to expect. Now it's been a year. I think we've come out of it better. Not to say that we haven't had losses. We've had losses. We've had very sad and tragic moments in this pandemic. But we want to stay hopeful, and we hope that our webinar will continue to bring hope to everybody. We just have to, laban lang tayo. We need to fight, right? and vaccination is one way of fighting back. So it's just what should I say? It's just very important for us to remember that we'll make it. We will make it. Pero dadaan talaga tayo sa butas ng karayom, no? And yung topic natin ngayon, sabi natin may COVID vaccines na, naiinip ka na ba? May time na nagagalit tayo. Merong time na malungkot tayo. Merong time na, we have some simple joys. But I think my sense is that there are a lot of people who are really waiting to get vaccinated. And today we are going to talk about what the plans are, what will be realistic expectations for us. Because sometimes we get frustrated because what we expect doesn't match reality. So I think we want to have a meeting between what we expect and what is possible. So realistic expectations, and to stay hopeful and positive, and to continue to be careful. So we've got some great guests today. Stay with us. And again, thank you everyone for being here, because without you, we have no webinar. Over to you, Raymond. Your certificates, I want to know.
Thank you, Dr. Susie. Thank you, Dr. Susie. So for those who are joining us for the very first time, ang ating pong format, there will be our main presenter, there will be also our reactors, and then we move on to a Q&A forum. For those who have already questions top of their mind, paki-input na lang po ito sa Q&A section ng Zoom webinar na ito. And for those who are wondering ano po ba ang itsura ng certificate of attendance, ito po, nasa harap po natin. At yun lang pong makakapag-stay for at least half or 50% of the webinar duration. They will be the ones to be given a certificate of attendance as well as copies of the presentation for today's webinar. For those who are asking kung bakit hindi pa po sila nakakatanggap ng kanilang certificate, please email us so that we could recheck again your duration and all other details. But we have already sent out all the certificates po for our past 44 webinars. So maraming salamat po, and over to you, Dr. Susie.
Yeah, okay, thank you, Raymond. And we're going to have our inspirational opening message again from somebody who's very familiar to you. He's almost, what should they say, always on the webinar, which is fitting and important. And we're just glad he's able to find the time to join us. Who, our Executive Vice President for UP is also advisor to the National Task Force on, Special Advisor to the National Task Force on COVID-19. So I'd like to welcome Dr. Ted Herbosa. Ted, welcome to your webinar.
Hi, Susie, and good afternoon to everyone. And congratulations, Susie. I heard the good news. I think you got jabbed, right?
I got jabbed. And I wish everyone could get jabbed. But Ted, what is we're going to talk about vaccination, but I think if I get the pulse right, I think people are concerned that there's increasing number of cases of people who are testing positive. What's your assessment of the situation?
Yeah, it's been a roller coaster ride. No? As you said, March 16, the president announced enhanced community quarantine, and it was implemented March 17, the following day. It was implemented, and that was 2 days ago. It's been a year. We're still in general community quarantine here in Metro Manila. Some places in the Philippines are now in MGCQ. But the sad part is we were expecting to go to MGCQ, or modified general community quarantine, at the middle of this week or at the end of this month. Unfortunately, we have a spike of cases, which I already call a surge of very many cases, and the hospitals are getting filled up again. And it's like a deja vu of what happened also March last year.
So yeah, I think, Ted, the important word that you used was we were expecting things to settle down, for cases to go down, but they didn't. So I think my question now is not to put you on the spot, but what are we expecting now?
Well, it was a very positive thing in March 1 when we started vaccinating with Sinovac, the health workers, and then a few days later, COVAX delivered their 525,000 doses. So we were able to bring into the country 1.1 million doses. And I think it's timely that our talk today will be someone from public health who's dedicated all his life in public health and understands the whole process of the immunization program. You know, as a clinician, I always thought it was so simple to inject a vaccine on a person. It's harder to operate a Whipple's operation or a major operation. But when I became Undersecretary of Health for 5 years, I realized how difficult it is to implement a nationwide vaccination program, much less to target 70 million of our people, 70 million of our 110 million. And to think we have several vaccinations program, we never reach 100%. We always fail to about 90, and then it became worse when we had some problems with the dengue vaccine, and we came out of that. So I think it's very important that people understand what our speaker will talk about today. I think it's very important that all clinicians understand the difficulties faced by our public health professionals in implementing an immunization program.
Yeah, Ted, what do you think of the spread? Is this, so you said dumadami, almost like a vertical curve, no? And that the hospitals are filled up. But is it a milder kind of COVID that we're seeing in your feedback? You were saying earlier when we were off the air that you had a meeting with the ER. So
Yeah, so what's happened now is we've done biosurveillance at the UP Philippine Genome Center. So all positive tests from different regions of the Philippines are sent to the Philippine Genome Center for genetic full genome sequencing. So we identified the variants that are present in the country now. We have the UK or the B117 variant, which is supposed to be milder but more transmissible. We have the P3, which was originally variants of concern found in Cebu and caused that spike in Cebu, which is now identified as the Philippine variant, as the P.3 variant, which has been found to be very aggressive and is claimed to be related to the Brazil variant, which is the P.1. And that one's supposed to be deadly. So the answer to your question, are they milder? We're seeing milder cases now. Most of the cases we see are whole households going to an ER. That's what the ER doctors were telling me last night in the meeting of the Philippine College of Emergency Medicine. But the same experience that they had in March of last year is reliving now. Their nurses can't work. The hospital can't open all the COVID beds because there's not enough nurses. So what we call it in ER, the access block. So they accumulate, the patients accumulate in the ER, queuing and waiting for their bed, while the block is really in terms of access to hospital COVID beds and hospital ICU beds. So this is not a good thing because descriptions are like someone sits in a wheelchair because there's no more stretcher in the ER and waits for hours and even days before they get admitted to a bed. So we need to implement a surge. Talagang I think it's time to reopen our surge capacity, and the hospital admissions are at the critical level. So we're at that level. We need to stop this transmission with minimum public health measures, but we also need to surge our capacity. So vaccination is one additional Swiss cheese we can add, and I'm really glad many of the health workers are getting injected already to protect them in this particular battle. Second round.
Yeah, the vaccination, of course, no. Even if we have limited numbers, we're talking 2 million shots. That's 1 or 2 million people who will not carry the disease. So even if we're saying it's slow, for me, whatever we are able to add is important. But we were talking about this earlier, that, and I agree with this completely, that we have to have testing really in the hands of the people at the level of the home, because these go hand in hand, right? Testing, vaccination, contact tracing, isolation, these are all coming together. What's the thinking around having more testing so that people will know immediately if somebody has COVID and can immediately isolate, and it doesn't keep on spreading? Kasi we're saying it's highly contagious.
So
Are
that's
we
correct. That's
about
correct.
that?
I think people stop to realize that when you do lockdowns, whether it's a surgical lockdown, a localized lockdown, or a citywide lockdown, or what they do in the UK, circuit breaker lockdowns, whether you do that, the next step has to be testing. Testing,
Yeah.
testing, testing. You need to do a lot of testing so that you can identify those infected and separate them. That's the way to stop or contain the transmission. And then together with testing, and you have to make it available to the people. UK did a very nice thing because the NHS produces home test kits, and they were using this. So this is something our authorities should probably start to think of, wherein home testing is available. And there's one that can be done, which is the saliva test. The saliva test offered by the Red Cross. People can be given the kits at home as long as someone can supervise and see that that's the person that gave the saliva, and then the test can be brought for PCR. So I think that's a way to ramp up testing. We need to ramp up testing at this point of the surge.
Yeah, great. Okay, so Ted, sorry nagkantuhan tayo.
Sorry. Thank you very much, everyone. It's been a year of community quarantine. President Duterte announced that on March 16 and implemented it in March 17. For me, it's also my 1-year anniversary working as a special advisor to the National Task Force, because immediately after that was implemented, I was called by the Office of Secretary Galvez to help out in the National Task Force. And today, my job description has changed. It's now become to help out in the National Vaccine Operations Center to help USEC Mirna Kabutahe implement this rollout, which we will hear from our speaker today. So thank you to the speakers. Our speakers, we have a bunch of regulars. There's Enrique Tayag and there's Ong Lim. But I'd like to welcome most especially our new reactor, which is Ria Baltazar. I've worked with her. She was one of our hospital directors in Region 3 in Bataan, where my wife comes from. So welcome and thank you for joining us. To the many thousands who continue to watch us weekly, you fuel us. We feel we're able to deliver you something by the thousands of you that actually watch us. I asked our staff what is our footprint from, let's say, last week, and they told me it was like 12,000. So that's amazing. We have 3,000 to 4,000 at Zoom, another few thousand at our Facebook and all the shares. So I do hope we're making a difference and we are able to share the information and get the experts to come here and share their information so that we can fight this pandemic. Thank you very much and welcome everyone.
Thank you very much. That's Dr. Ted Herbosa, UP's Executive Vice President. And Ted, thank you. As I said, you're our lifeline to the IATF and the National COVID-19 Task Force, delivering to us the latest news, developments, and just the updates. No? So information is so important in a pandemic, and I think your contribution to this process is really so precious to all of us and to all our listeners who feel a little more calm. I think nakakalma tayo when we hear what's going on, and that we have very transparent discussions. We don't sugarcoat anything. We like to bring you the facts, and we like to talk about difficult things. And that's our work as health workers. So 12,000 strong. So congratulations everyone. Almost 1 year na tayo, malapit na sanang matapos ito. I mean, marami pang gagawin. Okay, Raymond, over to you.
Thank you for that message, UP EVP Ted Herbosa, and thank you, Dr. Susie. Right now, may I call in TVUP for our fun quiz and our audience survey. There we go. I hope nakikita po ng ating lahat ng nasa Zoom webinar ito pong ating survey. The first few questions, as in previous webinars po, will ask kung saan po kayo at essentially demographic information lang naman po. So we hope that you'll be able to key in your answers and join in this fun survey. The first question, it reads, what place are you viewing the webinar from? So all of these po really are regions in the country. Hope marami po ang ayun po, pumapasok na po ang mga kasagutan at sana po ay mas marami pa po out of our 1,459 attendees here in this webinar ang sumagot. Okay, next up, what is your line of work? Yun pa rin po, medyo the first, yung ating first two options, yun po talaga ang pinakamaraming attendees natin from the medical field and from the nursing field. We hope to be able to gauge kung sino pa po ang nandito po sa ating Stop COVID Deaths webinar series. Yung pong others comprise 9%, almost 10% na of our attendees. So we hope to be able to tease that out. The next few questions will be dealing specifically on the content for this webinar. The projected number of individuals in the Philippines who will receive COVID-19 vaccine ngayong taong ito, 2021, is option A, 10 million. Option B, 30 million. And option C, 50 million. Medyo hati-hati po ang ating mga audience. So we hope to be able to get the correct answer from our resource persons po. Number 4 will be all about our vaccine coverage. Pero before that, meron pong shout out dito po sa ating chat. Those from Pasig po, maraming salamat po sa inyong pagdalo from Pirino Memorial Medical Center. Also, those watching from GMA Cavite, from the Philippine Academy of Dental Public Health, maraming salamat po. Philippine High School for the Arts in Mount Makiling in Los Baños, Laguna. So maraming salamat po. We have those who are from the arts na who are joining us also. There are those, let me just pull that up, joining us from Nueva Vizcaya, Cagayan Valley, from Lipa, Batangas, from Gubat, Sorsogon in Bicol, from the Negros Oriental State University in Central Visayas, and from Socsargen General Hospital in Surala, South Cotabato. So maraming salamat po ulit. Number 4 question reads, vaccine coverage is option A, the number of those who got vaccinated over the eligible population. Option B, the number of those who got vaccinated over the total population. Option C, the number of those who got vaccinated over those who did not get vaccinated. So ano po pala ito, may konting math po tayo for today. Ano po? Don't be intimidated. Please just key in your answers po, no? And the last two questions will be, how soon do you get the antibody response of the second dose? Is it 7 days? Is it 14 days? Or is it 21 days po? And then finally, our last question for our poll, how long are you protected from COVID-19 after vaccination? Is it 6 months? Is it 1 year? Is it 3 years? Or wala pong nakakaalam? It's unknown? So patuloy nyo lang pong sagutan ang ating fun survey as we move on with our program, and Dr. Susie will introduce our main speaker for today.
Okay, thanks a lot, Raymond, and thank you everyone for participating in the poll. Malalaman natin mamaya ano yung mga tamang sagot. Before we go to our main speaker, TVUP actually goes out and asks ordinary people their views on the topic that we're taking up today. So we'll turn over to TVUP for your interviews on the street.
Ako, magpapabakuna ako. Kasi syempre, ano na rin natin yun eh. Kumbaga, responsibilidad na rin natin yun na maging ma-vaccinate tayo para hindi tayo makahawa.
Oo, magpapabakuna ako para protection sa COVID-19.
Oo, magpapabaksin ako para sa protection ng aking sarili at sa aking pamilya, gayon din sa ibang tao.
Personally po, gusto ko namang magpa-vaccine. Basta po, magkakaroon ako ng kalayaang mamili ng kung ano yung ibabakuna sa akin.
Hindi naman po ako naiinip dahil sinusunod ko po ang mga protocol para makaiwas sa virus na lumalaganap sa ngayon.
Naiinip na ako sa pagdating ng vaccine sa atin. Kasi yung mga dumarating sa atin ngayon, sila yung medyo hindi ganun kataas yung efficacy rate.
Sa totoo lang, medyo naiinip ako sa pagdating ng vaccine natin dito. Kasi syempre, lalo na ngayon, syempre kailangan natin mapag-vaccinate kumbaga as soon as possible.
Hindi naman po ako natatakot na maubusan dahil unang-una sumusunod tayo sa mga protocol na dapat nating gawin bilang mamamayan.
May mga kamag-anak ako sa US na parang ilang months ago pa yata sila nabakunahan ganun. So ba't parang dito hindi pa rin dumadating ganyan?
Natatakot ba ako maubusan ng vaccine? Oo, natatakot ako kasi syempre ang dami natin, tas di natin alam kung enough ba yung dadating na kumbaga amount ng vaccine sa atin.
Natatakot akong matagalan yung vaccination sa atin. Baka umabot ng ilang taon. Sobrang nag-worry talaga ako kada nababasa ko na it may take ilang years.
Hindi ako natatakot maubusan ng vaccine. Sana mas marami pang magpabakuna para makamit natin ang herd immunity.
Thank you very much. Thank you very much, TVUP, for those interviews, and I think sets the tone for our speaker for today. And I just like to say that one of those who were interviewed said nababakunahan na yung mga iba sa ibang bansa, tayo pa, no? And for me, I have very few regrets in my life, but one is that when I don't think I fought hard enough when I was Undersecretary of Health for vaccine manufacturing and in Philippine Centers for Disease Control. In the time of Dr. Kwasi Romualdez in the year 2000, we actually had money, a floor plan, and a vision to set up a vaccine manufacturing facility in Alabang. It was actually called the Biological Production Service. And our main speaker now knows about this, that meron na kaming drawing eh. In the year 2000, may drawing na. Meron ng plano na meron tayong production ng bakuna sa ating bansa. And I really, looking back, I feel bad that well, sometimes the opportunity is not there, but it's not like we lacked the ideas to do it. So today, when we think about vaccines, we're waiting for our turn. The countries that have vaccine manufacturing, yung mga gumagawa ng sarili nilang bakuna, meron silang bakuna. Tayo, nag-aantay tayo kung sinong maaawa sa atin na magbebenta sa atin ng bakuna. No? So, lesson learned. I hope that coming out of this vaccine, and I think Dean Charlotte Chiong, who's joining us in the end later, may speak to this topic, but we really have to become self-sufficient in vaccine production. Nevertheless, it is what it is, and here we are. So we have with us a public health expert who you are very, very familiar with, who has been with the Department of Health. He's an epidemiologist, and now he's handling knowledge management and information technology. And he's going to talk to us about the status of vaccination. And I'd like to welcome Dr. Enrique Tayag. Eric, welcome. Welcome to the webinar. Do you remember we were going to set up a vaccine manufacturing and Philippine CDC?
Yes, that was 20 years ago.
20 years
And,
ago.
if that was established, we would have been celebrating the 18th or 15th anniversary of those two important facilities that can actually promote public health even more.
Oo nga eh. So anyway, we cannot, as I said, I don't live a life of regret. I don't look back that way, but sometimes we have to take stock and say, never again, right? Never again. Dapat hindi na maging ganito yung sitwasyon natin na nag-aantay tayo. Anyway, Eric, you're in a very good position to tell us what's going on. And one of the things I did learn from you is how to talk about setting realistic expectations, di ba? Sa quality improvement in the field epidemiology training program, you do talk about how do you set realistic expectations. So I'm turning over to you. The floor is yours. I think our audience is waiting for your presentation on the status of the vaccination program in the Philippines. Go ahead, Eric.
Thank you, Dr. Susie. Thank you also, Dr. Raymond. And thank you, Dr. Ted Herbosa, and everyone in the UP community. I'm now going to share my screen. I'm just going to check, is the audio all right?
We can hear you, Eric. I
Okay,
can hear you.
and the slides are on the screen, I suppose.
Not yet.
Not yet?
We're not seeing it, Director Tayag.
Okay.
So Eric has this fancy way of making a presentation where he's
No, no, I'm gonna change it so that everybody gets to see the presentation as big. What's happening?
wala pa rin siya, Eric. What we're seeing is you.
Okay.
And let's try again.
How about that?
Yep, we can see that.
Okay. We're all set.
Okay, go.
Okay. COVID-19 vaccines. Naiinip ka na ba? Naiinip ka na ba sapagkat hindi pa dumarating yung inaasahan nating maraming bakuna na binibigay sa atin araw-araw sa ating mga news? Naiinip ka na ba sapagkat yung mga bakunang natanggap natin at dumating na sa inyong mga lugar, hindi ka pa rin tinatawag para mabakunahan? Naiinip ka na ba sapagkat nakatanggap ka na ng bakuna at ngayon gusto mo malaman kung may second dose ka? Ito ba ay after 4 weeks, 8 weeks, 12 weeks? Paano kung ang bakuna ay expired na? Naiinip ka na ba sapagkat sa inyong paghihintay ay magpapatuloy ka na magsuot ng mask? Pwede bang wag na mag-mask pag tayo ay nabakunahan? Okay. Good morning, everyone. Today, I'm going to share with you what exactly is happening behind the scenes. Best job in the world right now. Okay. 2 days ago, 315 million COVID-19 vaccines doses have been administered around the world. And that was in March 15. Right now, as reported on March 17, there are 400 million vaccine doses already that have been administered around the world. Israel at that time, together with the United Arab Emirates and the United Kingdom, led all countries in terms of the number of doses administered per 100 population. Israel, for example, is at 109. The United Kingdom and the United Arab Emirates over at 60 doses per 100 population. Now, exactly how many people in the world have been fully vaccinated? We have reached 85 million people in the world that have been fully vaccinated. And what are the preferred vaccines? More countries, that's 72, have used Pfizer and the AstraZeneca vaccines than any other vaccines that have been given authority for emergency use. Have you had your jab? Of the 1,125,000 doses available in the Philippines, 114,600 doses were administered from March 1 to March 10. Now, the March 14 updates, this has been upgraded to over 215,000 doses that were already administered to our frontline health workers, and hopefully all the vaccines we receive will be given in the next few weeks before the arrival of the next batch of vaccines that have been committed to us. In this screen, we also show you the breakdown. It just tells us that every region has received their vaccines, and health workers from this region have actually been given the vaccine. That's the good news. But naiinip ka na ba? Are you one of those who got a jab? Many are asking, because everybody knows that the priorities for the populations that will be vaccinated change from the time we had our plan, and now that we have actually looked at the situation. For example, in this slide, we show you that the frontliner workers in health facilities, both in the national and local, public and private, so there's no distinction between public and private, professionals and non-professionals, even students in health and allied professional courses with clinical responsibilities, nursing aides, janitors, barangay health workers. They're the A1 priority population. Now, the thing is, this is how our vaccination goes. After vaccinating this population, we now go to the next one in the hierarchy. That's the senior citizens age 60 years old and above. So yung tanong na naiinip ka na ba? If you're a health worker at naiinip ka na ba, then the senior citizens, naiinip na kami kasi hanggang matatapos na ba yan yung health worker? Sapagkat hanggat hindi kayo natatapos, mag-aantay kami. Much more so, the persons with comorbidities not otherwise included in the preceding categories. Naiinip ka na ba? So ako na may diabetes, kailangan ko pala mabakunahan sapagkat if I get infected and I'll be hospitalized, I run the risk of getting more complications and hopefully I survive. So naiinip ka na ba for those with comorbidities? Sa A4 naman are the frontline personnel in essential sectors. Katulad ko, kung hindi ako senior, ay baka dito ako sa A4 pa malagay. And this include uniformed personnel and those in working sectors, okay, mga nagtatrabaho sa gobyerno. So, naiinip ka na ba? So, kung naiinip yung mga healthcare workers, how much more yung ating mga seniors, those with comorbidities, at itong mga frontline. At syempre, yung ating mahirap na mga kababayan, naiinip ka na ba? So nagano sila, nakikita nila sa mga social media, nakapost tayo na tayo binabakunahan, nakangiti. Nagtatanong din sila, naiinip na kami. Pwede bang isali nyo naman kami? Okay. But many Filipinos don't know that we have a hierarchy of priorities, which I have just shared to you. Unless we secure the vaccines we need, then we will have this phasing for providing the vaccines. Okay, so in phase 1, that's the only vaccines we're going to use are those that have been approved by FDA under the emergency use authorization. So limited ang supply ng COVID-19 vaccines. So we have to concentrate on critical populations. So we have to rethink. For example, later, I will want you to think about it. What are we talking about of critical populations? It's still based on risk of exposure, mortality, burden, just like the list I have shared to you. Now watch phase 2. This is when large numbers of vaccine doses are available to us. So this will ensure us the access for the general population, particular to the working population. Now, there's gonna be a mix Maybe there are vaccines that have been given EUA. We don't know the period when it ends and when the clinical trials would have been completed, so that routine immunization will actually take over. It's not anymore an emergency use authorization, so that everyone will have this access to all the vaccines. And of course, phase 3, if I have a surplus of these doses, we want to make sure that everyone is vaccinated. So for phase 3, our call out, our shout out is not one less. Everybody should have access to these vaccines. Now, securing vaccine supply is not easy. You will hear from the news that our vaccine czar, Secretary Galvez, would have traveled to India so that he can come back and announce to us that he got a deal about 30 million doses from Novavax. And because it's the Serum Institute in India that's manufacturing this Novavax vaccine. And then you'll hear about the earlier announcement wherein we're set to receive over 117,000 Pfizer vaccines. And then there was the donation, and then we're having bilateral talks. So the AstraZeneca is from the COVAX facility. Okay, the Sinovac vaccines is from the donations. The bilateral agreements are independent of that we had negotiated with the COVAX facility. Okay, for the understanding of everyone, of so many countries in the world that have applications at the COVAX facility, we're only we're only 18 of over 5 dozen countries, and yet we still don't have the vaccines. So how does the COVAX facility operate? The COVAX is part of the trio of the accelerator of the WHO for the diagnostics, therapeutics, and vaccines. So because we want to make sure that the access to vaccines will be equitable, the COVAX facility was a partnership between the WHO, the Vaccine Alliance, and the CEPI, the Organization for Epidemiologic Preparedness, Innovations, and the countries that have manufacturing capacities, all countries that have self-financing mechanisms. But the COVAX facility's principle is that you don't get to access vaccine by your ability to pay. Everything will be fair and you will get your vaccines. So there's another mechanism separate from the COVAX facility, that's the advanced market commitment. And here, countries that have the funds can actually buy these vaccines, and these are the ones that are donated, okay? And so when these are donated, you know that these are from countries that have the finances for an advanced marketing commitment. And this is what the manufacturers want because it's risky to manufacture this for these vaccines. Mahirap sila sa kanila na gumawa po ng bakuna na wala namang order sapagkat napakalaki po ng investment po nila. Kaya nangyayari dito sa COVAX, parang isang palengke yan, may insurance policy. Pagkasama ka dyan, sigurado ka na makakakuha ka ng bakuna kahit papano. Pinangako nila na dito ngayon sa 2020 ay 2 billion doses ang magiging available. Yung mga high-income countries ay pwedeng bumili 10% hanggang 50% ng kanilang pangangailangan. Yung iba namang bansa na walang ganitong kapasidad na bumili ay mabibigyan hanggang 20% ng kanilang pangangailangan. So lahat ngayon ay nagtulong-tulong. Kaya sa COVAX facility na yan, nasisiguro na mas mura pa makukuhang mga bakuna. Tayo naman, ang ating bilateral agreements ay malawak kung saan-saan kung maraming bansa ang pinapakiusapan ng ating vaccine czar at nagiging magandang resulta. Sana tuloy-tuloy na pa yan. At syempre, tayo ay nagkakaroon din ng mga donasyon. Okay. Plan in motion. Alam nyo, meron tayong plano. Kasama yan yung sa vaccine deployment. Hindi po ito yung katulad ng mga ating mga serbisyong binibigay na hindi pinag-iisipan po ng maayos sapagkat kailangan po maayos yung plano po natin. Because if we don't have this plan, ay magiging kawawa po tayo. Kaya lang ang isang issue po dito ay nakarating ba ito doon sa dapat makaalam ng plano. Kaya nga itong ating webinar gives us an opportunity sa Department of Health para paliwanag sa inyo. So ito po makikita nyo sa screen na simple lang po ang plano. Ito nakikita nyo po. So importanteng magkaroon tayo nitong mga bakuna. Hindi nga tayo nagpo-produce eh. So kaya dinonate yan, binili natin yan o galing sa COVAX, kailangan makuha natin yung mga bakuna. Hindi lang ganun kasimple. Nakuha mo yung bakuna pero 3 taon naman yung inabot bago mo makuha yung bakuna. Aba, may problema yan. Kasi ito ang umpisa po, okay, sa plano natin. Kasi hindi po ito magtutuloy-tuloy hanggat hindi po ito nangyayari. Kasi paano tayo magkakaroon ng herd immunity? Wala kayong vaccines. Okay? So ito, dumating yung vaccines. Di tuwan-tuwa tayo. Hindi yan makakasalba ng buhay. It will not save lives. It's vaccination that will save lives. So kailangan ito makarating sa mga bakuna centers natin. Aba, logistic nightmare yan. 7,100 islands. Kung marami tayong klaseng bakunang kukunin, merong dapat ang storage ay minus 70 degrees. Meron ang dapat minus 20 degrees. Merong 2 to 8 degrees. Okay? At sa pagbibigay ng bakuna natin, nag-iiba-iba pa yung panahon natin. So, maging madali ba ang pag-deliver ng vaccine? Pag meron na tayong mga bagyo, pag-uulan, at alam nyo naman sa ating bansa, unpredictable. So kailangan planuhin ho namin yan para hindi inaabutan po na yan ay natatambak po sa warehouse. So kung dati-rati ay napupuna ang Department of Health, lalo na sa mga budget hearing na natatambakan yung mga supply, ito dapat ay kailangan matanggal kaagad sa mga warehouse namin at ma-deliver nga. So sa pag-deliver, ay kailangan maingat na maingat po. Kasi pag na-mishandle po ito, baka mawalan yung visa at maging dahilan pa to ng mga kinatatakutang mga adverse event. Kaya yan, importante yan. Tapos pupunta ho tayo dito, i-vaccinate yung priority individuals. Alam mo sa mga bata, ang dali-dali lang eh. O, pag mga baby, ito, newborn vaccine, ito. Pagdating ng 2 months, ito naman yung bakunang tatanggapin nyo. So, mga bata yon, alam natin kung sinong babakunahan. Ngayon, hindi natin masabi na lahat ng 18 years old babakunahan. Hindi. Sapagkat pinaliwanag namin sa inyo kanina, we explained to you earlier, may priority. Healthcare worker muna. Okay. So, nabakunahan na yung mga priority individuals. So, Ito, gaano katagal to? Kailan to matatapos? Okay? Kasi kumbaga sa ano, may panganay, may pangalawa, may pangatlo, may bunso. Okay, so si bunso naghihintay. Okay, kailan ako? Gutom na ako. Okay, samantalang si kuya nakakain na. So naghihintay siya ngayon ng rasyon niya. Ngayon, pag nabakunahan, hindi pa tapos doon. Sapagkat emergency use authorization to, we have to monitor for the adverse events following immunization. At saka, makapag-ambag tayo sa siyensya. Bagamat may mga pag-aaral sa mga bakunang ito, sa mga clinical trial, kailangan malaman din natin ang vaccine effectiveness. Yun ang kaibahan po, yung efficacy sa clinical trial, yung effectiveness sa real world situation. Katulad niyan, namomonitor ba natin yan? Paano minomonitor ng pamahalaan? Bawat ba nakatapos ng bakuna ay iti-testing every week para malaman kung sino ang na-infect. Yan ba ay follow up every year? So yan po ay malinaw po na pinaplano. At katagalan po, itong araw na to, nakikita nyo maigsi, pero pwedeng mahabang mahaba yan. Lalo na ay may pag-aagam sa ating lahat kung gaano kabilis at gaano karami mababakunahan para magkaroon tayo ng herd immunity. Paliliwanag ko sa inyo ang sub-prioritization ng facility type sapagkat dito natin matatagpuan ang ating mga healthcare workers. So, nauna na ang PGH sapagkat isa po kayo sa COVID-19 referral hospitals. Nasama dyan dalawin naming ospital, ang Lung Center of the Philippines and the Jose N. Rodriguez Memorial Medical Center. Pagkatapos po niyan, yung mga public and private hospitals and infirmaries providing COVID-19 care. Susunod naman yan, bababa sa mga ospital na tumitingin ng COVID at saka ng COVID. Malamang to yung aming over 70 retained DOH hospitals, kasama na yung mga local government hospitals at yung maliliit at matalaking private hospitals. Tapos, susunod pa dyan ang isolation and quarantine facilities such as temporary treatment and monitoring facilities. Tapos, yung remaining hospitals sa mga uniformed personnel na hindi naman nagkakaroon ng mga pasyente na may COVID. Yung government-owned primary care facilities sa community na tayo niya na, yung urban health center, rural health units. So nakikita nyo naiinip ka na ba? So hindi lang yung mga health workers ang naiinip, kundi yung mga health workers sa iba-ibang facility. So number 7 nga lang to, yung standalone facilities. So kung may sarili kang clinic, ikaw ay dentista, hanapin mo, kailan kaya ako mababakunahan? Health worker ka nga, pero sa sub-prioritization ng health facility, nasa number 7 ka lang. At tapos ito, may number 8 tayo, yung congregate settings, katulad ng mga nursing homes, yung mga kulungan, correctional center, okay, drug treatment and rehabilitation center, nasa dulo po sila. So, paano na yung senior? Naiinip ka na ba? Biro mo, uubusin muna natin lahat to. So yun ang nasa plano kung yung healthcare worker at ito nga yung by facility type, kailan tayo matatapos? So dapat talaga may organisado tayong plano paano natin gagawin. Hindi ba pwedeng sabay-sabay na lang yan, tatanungin natin. Hindi ba pwedeng yung kailangan mauna muna yun, tapos bababa dito. Hindi ba pwedeng sabay-sabay na lang yan? So makikita nyo naman ay paano natin i-allocate yung vaccine. Ang pag-allocate ba ng natin vaccine ay tingi-tingi para may parang token lang yung ibibigay. Okay? At tingnan naman natin ito, isang paraan pa ng sub-prioritization. O sige, hindi prioritize nga natin yan by health worker, prioritize natin by health facility. Pero dahil ito lang yung bakuna natin, Pwede ba nating isa-prioritize yan by geographic location? So yung pinakamataas kung saan na aktibo yung transmission. Pangalawa, yung vaccination site, yung bakuna center na mismo na talagang kitang-kita mo naman nangangampanya sila. At syempre yung mga rehiyon, depende sa listahan nila na sinishare naman nila, ganun yung gagawin. Ngayon may kasabahan pa nga sa mga epidemiologists. Di ba tinuruan tayo na baka hindi magbakuna kung saan intense ang transmission sabagat malamang sa hindi mga babakunahan mo baka nag-i-incubate na. Pero marami rin naman nagsasabi, may mga infectious diseases tayo na ang bakuna ay nakakatulong sa outbreak management. So, ganun din ba magiging epekto ng bakuna natin kung sakali na ang pipiliin nating bakuna at itong gagawin nating strategy, halimbawa sa Metro Manila muna. Launch, learn, level up. Importante po itong pinakikita ko sa inyo ngayon. Lahat po na nangyayari ay nandito po sa bandang kaliwa, itong gray box. Nag-i-start pa lang tayo. We have launched our vaccination campaign. So, baka kala nyo ganun kasimple. It's not. FDA has to work doubly hard. It should make assessments and provide the emergency use authorization approvals. May independent pa na mga recommendations ng NITAG, ang HTA Council. And then we have to secure the supplies. Dapat malinaw ang ating inventory. Tapos ginawa namin to yung master listing katuwang namin ng Department of Information Communication Technology. Meron tayong tinatawag na VIMS, the Vaccine Immunization Management System. Ang original plan dito ay end-to-end sapagkat kailangan gumamit tayo ng technology. So kayo, kung maalala nyo, ay yung mga pangalan nyo po na-submit ho sa DICT. Okay? So itong listahan to, pagbabakunahan na kayo, pwedeng balikan para sa ganon, mabilis po ang verification at kayo magbigyan na kagad ng bakuna. Okay? Sa bakuna center naman po, ay kailangan mag-register po sila. Kasi importanteng malaman natin, saan ba babakunahan ay yung mga senior? Sila ba ay kaya pang lumakad? Anong pinakamalapit na bakuna center? O yan ba ay may iba pang strategy sapagkat sa ngayon ang plano ay lahat ay fixed post sapagkat maselan po yung kinakailangan na temperatura sa mga bakuna at kailangan po trained. Hindi po sapat yung bilang ng na-train natin kaya kailangan fixed post. So kailangan natin ng maraming volunteers kaya pati pharmacists we're trying to reach out to you. Allocation and delivery of supplies. Nako, kung pwede lang yung AI, okay, yung artificial intelligence yung gumawa nito para na sa ganon, hindi tayo magiging Haring Solomon na kanino pa di-deliver, aling ospital, sino sa kanilang babakunahan. Lalo na at hindi sapat yung supply. So napakahirap po sa amin yan. Sana maintindihan nyo. Kasi kailangan namin i-coordinate yan sa mga flights. Okay? At bagamat meron kaming courier, kami ay katulong din sa mga problemang lumalabas dyan. Tapos meron pa tayo siyempre mga ceremonies para ma-roll out yung mga vaccine, paraan natin para ma-promote at magkaroon tayo ng advocacy at tumaas yung vaccine acceptance at confidence. Cold chain and inventory. May sapat ba tayong storage, facilities, warehouse? Tama ba ang temperatura? Baka naman masira yung bakuna. Adverse events following immunization reporting and notification. Siyempre, lahat tayo. Konting kati lang gusto nating i-report. Headache, i-report. Lahat yan pag-aaralan ng isang komite para na sa ganon. malaman natin kung ito ay may kinalaman sa bakuna o hindi pa. At ito ay importante sapagkat kung hindi natin gagawin to, maraming matatakot at mahinto na naman yung pagbabakuna natin. Katulad ng nangyari sa AstraZeneca from many European countries, yung kanilang blood clots, na ngayon ay binabalik na ulit sapagkat naglabas na ang European Medicines Authority ng kanilang resulta sa pag-imbestiga na hindi naman walang kinalaman yung blood clots sa AstraZeneca vaccine. Tapos itong performance monitoring and result sharing. Somebody should be accountable. Someone will be accountable. The DOH will be accountable. Anong accountable ng local government unit? Kung akala nyo po ang gobyerno lang ang may accountability o kaya private sector, hindi po. Bawat isa po sa atin ay may accountability. Okay. Ngayon, punta po tayo dito sa gitna. Itong orange box. Ito yung learn. Dito, kailangan tayo mag-adapt at mag-adjust. So, dahil sa mangyayari ngayon, kalauna magtatanong tayo, mas magandang bang 2 klase na lang yung bakuna natin kaysa 5 o 6 yan? Kailangan ba kompleto yung menu natin? So parang restaurant, kailangan ba merong menu, maraming pagpipilian? O isang item lang? Okay. Pag isang item ba nakakasawa? O kung may 5, sinasabi nga ng taong bayan, wala ba akong choice? Hindi ba pwedeng mamili? Ngayon, paanong paraan para makakuha tayo? Mukha ang higpit-higpit ng COVAX. Ang hirap magparating ng bakuna dito. Tayo ba ay sumisigi-sigi na lang sa bilaterals? Or kung naglalaro tayo ng baraha, sige, tayaan lahat yan. Para na sa ganun, meron tayong asahan sa COVAX, meron din tayo sa bilaterals. Ngayon, ang ating bang pagbabakuna ay by priority individuals or by some other mechanisms of prioritization. Sa ngayon po, nagiging parang komportable yung lahat sapagkat yung bakuna na natanggap natin, over 1,100,000 doses ay na-deliver na. Paano kung biglang bagsak ng milyong-milyong yun? Saan pupunta yon? So kailangan nakahanda na po tayo. So, kailangan malinaw. So, siguro nasa start pa yan, pero kaya mag-adjust. Fixed post ba or bibigay tayo balang araw na hindi kakayanin kung fixed post? Kailangan dumiskarte tayo sa house to house. O kaya naman, may mga bakuna na natapos na yung clinical trial, kailangan mag-decide tayo na bibitawan na natin itong EUA, dito na tayo sa routine immunization. Tapos ito naman sa amin sa ICT o IT technology, yan ba ay tayo magdi-develop o tanggapin na lang natin yung outsourced technology sa mga third-party vendors sapagkat marami namang matalentong mga Pilipino. At syempre, ito pagtatalunan, ano ba, survey na lang tayo ng survey o talagang gumawa tayo ng mga research? Kailangan din yan ng investment. Ngayon, pupunta po tayo dito sa kanan. And here, ito po yung green box. Dito po tayo sa kanan. So matatandaan nyo na na-launch na natin. So mga buwan o taon na nagbabakuna tayo. May pagkakataon tayo ngayon na makapagplano. Ngayon pa lang. So iniisip po namin sa gobyerno, okay, tayo ba ay doni na lang, naghihintay na tumanggap? Okay? Or tayo na yung manufacturer ng bakuna? Okay. Tayo ba ay tanggap lang ng donasyon or tayo naman ngayon ang tumutulong sa ibang bansa at tayo ay donor? Tayo naman ba ay matutuwa na lang at may ilan tayong ginagawang vaccine clinical trial sites or nagtutuklas tayo ng mga bakuna sa ating mga vaccine laboratories. Katulad nga ng sinabi ni Susie kanina, 20 years ago, there was a dream. Okay. Ito ba ngayon ay printed vaccination cards lang ang kaya natin? Okay, hindi ba natin na bilis-bilisan pagtulungan para meron tayong hindi lang digital vaccination cards, kundi digital immunity cards. Okay. Kalalabas lang po ng batas yung Vaccination Act para pagsuporta sa COVID-19 vaccination. Nakasaad doon na yung Secretary of Health pwede magdeklara balang araw na pagkailangan ng vaccination card at may patunay na ito ay talagang matatawag nating immunity cards, so ito ay maaring maibigay. From government appropriations to PhilHealth benefit. So pinag-iisipan na ba yan? Ngayon, ng PhilHealth para nang sa ganon, sa mga susunod na taon ay hindi na po naglalabas po ng pera po ang mga mambabatas natin through appropriations o mga bagong batas sapagkat meron na tayong mekanismo sa PhilHealth. At ngayon po, yung FDA, country-sanctioned FDA natin, sinusundan yung mga national regulatory authority sa ibang bansa at kung maganda naman ang kanilang assessment doon, ay sinusundan namin. So inaasahan natin ng FDA ay isang magiging malakas na national regulation authority na may respeto yung ibang karatig bansa natin na dito na rin nagpapa-assess ng mga bakunang. Sapagkat marami pong bakunang candidates, hindi lang po itong 11 that are available now. So how do we manage expectations? So kanina, earlier, Susie said that it's about expectations, it's about desires. Ang kaibahan ng desires ay yung pinapangarap natin. Expectations yung grounded tayo sapagkat I've just presented to you what we have. So kaya ano yung expectations natin? So by year's end, half of 166 million COVID-19 vaccine doses are exactly available. 80% of the 25 million priority target individuals have been administered with at least one dose of any type of COVID-19 vaccine. 50% are fully immunized. So kung 2 dose yun, 2. Kung maumpisan yung Johnson, 1 lang dose. 0 serious or life-threatening adverse events. Is that going to happen? Decreasing numbers of new cases per day. Maraming nakitaan yan sa Israel. Biglang bagsak kahit sa UK, kahit sa US. So sumunod kaya tayo pag nag-roll out ng ganun tayo karaming magbabakunahan every day? Binanggit mo din Secretary Galvez, based on the calculations, sa April baka kaya natin ng ganito karaming nababakunahan every day. So halimbawa, 250,000 every day. So susunod na buwan, tataas natin sa 500,000 to 1 million every day. Tapos sa susunod na buwan ay mga 2 million hanggang 5 million na nababakunahan every day. Pero syempre yan, hindi mangyayari po yun kung wala yung bakuna. At pag nangyari po yan, can we see the transition to new normal? Inaasahan yan by year's end. Sa dulo, but wait, which year? Okay. Maraming salamat po sa inyo. Vaccines do not save lives. Vaccination saves lives. In everything, all of this, it is all up to us. Maraming salamat po.
Okay, thank you very much. That's Dr. Eric Tayag. Very comprehensive and provocative presentation, Eric. Love it. I think if you look at the chat box, there are 37 questions waiting for you. So while the reactors are speaking, maybe Eric, you can answer these questions. So lots of questions in the chat box, lots of interest, and I think maganda talaga yung meron tayong malaking pananaw. Minsan kasi iniisip natin yung sarili natin, pamilya natin. Of course, that's very, very natural. But as health workers, as frontliners, and that's our audience are the frontliners of the Philippines, we always have to have a bigger picture. So it's great to have a public health expert like Eric explain that this is quite complex, but it is not something that we can't achieve. We can do this. So thank you so much, Eric. I'm gonna turn over to Raymond, and while there are speakers, Eric, sagutin mo na yung fans mo, marami. 40 questions na. Okay, Raymond, over to you.
Thank you for that, well, as one of our attendees said, enlightening and well-delivered presentation, Director Tayag. Maraming salamat po. We'll move on to our reactor po. She is the professor and chief po of the Section of Infectious Diseases, Department of Pediatrics at Philippine General Hospital. She's more popularly known as one of the members po of the Technical Advisory Group of the Department of Health. She's none other than Dr. Ong Lim. Ma'am Ana, for your reaction po.
Thank you, Raymond, and good afternoon, everybody. Thank you, Dr. Tayag, for giving us such a broad perspective on the current situation with respect to the vaccine rollout. It's certainly a lot to think about, no? And even as someone who's already working very closely with this team, ang dami pa rin panibagong insights na I think bilang tumutulong, no, sa programa, kailangan talagang pag-isipan ng maayos habang may panahon pa bago magkaroon ng full distribution or deployment in the different categories and sectors. So siguro yung pwede kong i-share, no, coming off from your presentation, is to tweak the question a little bit. Nagsimula tayo dun sa perspective na naiinip ka na ba? So siguro ang gusto kong itanong is bakit ba tayo naiinip? And for me, I think there are some positives and negatives that can be drawn out of that question. And maybe the first thing is kung naiinip nga tayo, I think it indicates that people have an appreciation of what vaccines can actually do in response to the pandemic. Naiinip ka kasi gusto mo nang magkaroon ng bakuna kasi alam mo na makakatulong to sa'yo. And maybe I'd like to challenge the validity of that statement, no? And turn it around a little bit. Sa tingin ba natin makakatulong ang bakuna? Now, early reports coming from countries that have been able to roll out their programs more rapidly, like for example, Israel, which started in December, show very encouraging information because as they've already covered about 50% of their population, they've also shown a significant decrease in terms of the number of hospitalizations and their number of cases. So kung ang tanong natin is, bakit ba tayo naiinip? Dahil ba sa tingin natin malaki ang maitutulong ng bakuna? Then the answer, I guess, is yes, no? And this is consistent with our understanding of what vaccines can do. Another way to look at this is, bakit ba tayo naiinip? Kasi ba sa tingin natin, or rather, dahil ba bumalik na ang tiwala natin sa bakuna and we understand that this will be helpful in the fight against COVID? So I hope the answer to that is yes, no? And it's encouraging in light of the initial data that we heard from the early surveys conducted in 2020, where about 30% of those who responded to the survey said that they would not be vaccinated. So maiinip ka lang kasi gusto mo siyang matanggap, and sana naman hindi na, or rather mas tumaas or mas dumami na yung gustong makatanggap ng bakuna. Isa pang aspeto, no, to try to answer this question of bakit ka ba naiinip is maybe because dahil ba walang masyadong clarity kung kailan ba tayo aabutin ng mga bakunang ito. Being a pediatrician, no, I kind of try to look at some of these issues from our perspective, naisip ko para yung bata na bumabiyahe, di ba? Yung are we there yet? Kailan ba tayo makakarating dyan? Bakit hindi pa ako come around when we don't explain and relay the information as clearly as we ought to. And I think your presentation really answered that, no, Dr. Tayag. You talked about ano ba talaga yung objective ng programa, bakit ba unang binabakunahan ang healthcare workers and senior citizens and those with comorbidities? Kasi ang objective is not as much to cover as many people as possible, but to try to efficiently contain the pandemic. And this is by addressing those who will get sick or die. And those groups that we identified are the ones who we really need to target so that kahit hindi pa natin cover yung malaking proportion ng population, meron na tayo makikitang impact dun sa vaccination program. So when again we talk about bakit ba tayo naiinip kasi hindi natin na-relay yung objectives ng program. So trabaho yan natin, no, as public health practitioners, dahil ba hindi natin na ipapaliwanag kung paano ba ang proseso. So trabaho pa rin natin yan as the public health authorities. And dahil ba hindi klaro yung timetable kung kailan natin naasahan itong bakuna. And once again, that's a challenge for us in public health. No? So I guess the bottom line for that last part is the need for better communication para ma-manage natin, no, yung expectations as you also mentioned in your presentation. So another tweak to that question is, kung naiinip ka na nga ba, anong pwedeng gawin, no? Alanganin naman, sabihin na lang naman natin sa mga tao na habaan mo pa ang pasensya mo kasi hindi naman magandang sagot yan. And we need to appreciate the fact that people are starting to ask these questions because they're engaged, they want to be involved, they want these answers. And so I guess the better way to approach this is, so sige, kung naiinip ka na, ano pwede mong gawin? No? How can you address yung pagkakainip na yan and turn it into something productive? So marami naman talagang taking matters into their own hands. And in fact, yung mga nagre-rehistro either sa LGU or sa kanilang mga kumpanya sa private sector or even yung mga homeowners associations o kung ano-ano pang mga civic societies na nagpapalista ng bakuna, they really are taking matters into their own hands, putting their money where their mouth is, nagda-down payment, nag-50% payment. Now ito, actually I have very mixed views about this. At the start, no, working with the program, I felt this was really added confusion. Pero ngayon, maybe we really need to think this through once again and understand that we really need all hands on deck. And maybe the answer to this is to organize, to get everybody on the same page and maybe divvy up the work. Kasi there's really more than enough work to go around. And maybe just by organizing this and trying to assign particular sectors to manage and monitor, we might be able to get more headway into the deployment aspects of the program. Kasi with the target that we've set, millions and millions and millions of doses, I doubt that any sector, private or public, will be able to do this alone. So kung naiinip na nga tayo, gawan na natin ng paraan habang inaantay pa natin bago dumating yung bakuna. Siguro the final point I'd like to raise is kung naiinip na nga tayo and alam natin na sagot ang bakuna, tandaan din natin na hindi ito ang tanging sagot. Marami pa tayong pwedeng gawin. And in fact, importanteng gawin na ngayon ito. So one of the things that we have to recognize is that even if the vaccines become available, there's no proof right now that they are transmission blocking. No, so there's no solid proof. And so we need to continue to keep our numbers down. Otherwise, by the time these vaccines come, ang ating herd immunity threshold ay tataas ng tataas. Right now, the ballpark figure that we're trying to, or that we have at hand is 70%. Pero alam din natin na ang ating reproduction number has been increasing, particularly in the past past few weeks dahil surge. So, as these vaccines are coming in, we need to keep our numbers down. Otherwise, dumating man siya, mahirap abutin yung gusto nating makuhang herd immunity threshold. And I don't want to think about the possibility na baka maging imposible to abutin, but I think we always need to work on worst case scenarios to be ready. So that's all from my end, and thank you for the opportunity to join this webinar.
Thank you so much, Dr. Ana. So that's a refreshing take naman po. No? It's not more of about kainipan or anything of that sort. It's more of from a preventative approach po at really taking care of ourselves, just strengthening all of our minimum public health standards, more on the compliance side, and really to protect ourselves imbis na ano po, we focus on baka magkasakit, etc., etc. Okay, Dr. Susie, I'll turn the floor over to you for the introduction of our one other speaker po.
Okay, so we have Raymond. We've got one more reactor, and it's really my honor to introduce her. I've had the chance to work with her on the ground in Bataan. The province is very close to my heart. I did some work with their team, and when you see Dr. Ria Baltazar on the ground, you know you're dealing with a general, no, parang commander ito no. She is the director of the Bataan General Hospital Medical Center. She turned this medical center around and really has done amazing innovations in the province of Bataan that we have not, you rarely see it in these provincial hospitals, but she has done it. So I'd like to welcome Ria. Ria, welcome to the webinar. And we are going to hear from her what she has been doing at the Bataan General Hospital and Medical Center. And because we do know that the local governments are going to play a big role in this rollout. And she's done a lot. She's got her own stories to tell. And like Eric, she's not going to sugarcoat you. She's going to tell you what's really going on, what the challenges are, what the problems are. And this is why we all love Ria. Okay, Ria, go ahead, please. Welcome, Ria.
Thank you, Dr. Susie. My reaction will be focused on the acceptance of the priority group or the healthcare workers for the already available vaccine, amidst the reality that a lot in the community are already naiinip as they really wanted to know when they will be finally vaccinated. So may I share my slide, please? I have prepared few slides.
Okay, let's see. Do we have Ria's slides up? Okay, I think Ria, you have slide sharing.
Yes.
It's still disabled. May I share my slide, please?
Let's try again. Slide share for Doc Ria. Okay, Raymond is co-hosting. Raymond, please give Ria.
She's
Please
now
share.
co-host. Director Baltazar is now co-host po. So she should be able to share her slide.
Dapat Ria, baka kaya na ngayon. Try mo. Actually, ito si Ria Tech ito Ginawa niya yung mga electronic medical records ng Bataan Sige, Ria, try mo na ngayon.
Okay.
There we go. Okay, konti na lang. Okay, there we go. We can see it now, Ria. Go ahead. Okay, you're on mute. Please unmute, Ria. You're on mute. We can't hear you. Still on mute, Ria. You were on mute. Ulit. Try natin ulit. see what's going on. Okay. No audio, cannot hear you. All right. Sorry. Okay, there we go. Okay, very good. Sige.
Good afternoon. First, I would like to express my profound gratitude to the organizing committee of this webinar for the opportunity of sharing my thoughts about vaccination campaign. I am hoping that I can fully sync my reactions in the context of Director Enrique Tayag's discussion. But before I proceed, please allow me to greet our former USEC, Dr. Ted Herbosa. Hello, sir. Dr. Susie Pineda Mercado, whom I had a chance to work with when she was in Bataan, and to my professors and mentors in the College of Public Health, to all members of BGHMC family, and to all the participants of this webinar. Again, good afternoon. Let us look briefly on how BGHMC survived the first year of this COVID-19 pandemic up to this present time when we are already rolling out the vaccination campaign. Just like any other health facility, locally or even globally, we were unprepared to handle this pandemic. As to our facility, we do not have isolation rooms with negative pressure. We just have ward accommodations. Adequate provisions of PPE was also a question. Accessibility to testing center. Adequate infection and prevention control measures. We suffered from health facility outbreak in April 2020. It affected about 100 of our employees, which made us decide to lock down our BGHMC. The situation was not easy, for we have to take care of all our employees and patients who were positive with COVID and those who were admitted for other illnesses. All were tested, and it took 3 weeks to cover all those who were inside. We formulated 6 objectives in response to COVID-19 pandemic to provide quality care for all our employees and patients with COVID-19 and those non-COVID cases, to control transmission within and outside BGHMC, to put up a biosafety level 2 PCR laboratory with gene expert and RT-PCR regular type. We also wanted to have a license annex for non-COVID cases and to continue our residency training program. All of these objectives were achieved because of the dedicated BGHMC employees in collaboration with the province, religious sector, and private institutions. They provided us food during lockdown. Hotels in the vicinity were all used for our employees. While we were exclusively attending to COVID-19 cases, the province entered into a MOA with all private hospitals in the province to accommodate the displaced indigent patients. The province also provided us a building at the Provincial Health Office, which was renovated into a PCR laboratory where negative pressure was installed. We jointly equipped the PCR laboratory. Its manpower and operationalization is our responsibility. We did not know that our pre-pandemic effort to digitalize all our transactions, like the online SDN referral system between RHU, district hospitals, and BGHMC, and the electronic medical record would be very handy at this time. We just incorporated the case investigation form needed for PCR when our laboratory was licensed and eventually used by all referring facilities to us. Now, how did we continue to work in the light of preparing for the vaccine campaign? Immediately, the province called different offices and created a task force. This consists of 3 phases as shown on this slide. Survey, use of app for QR and registration, master listing, risk communication, cold chain management, surveillance, and AEFI response plan were covered during the micro-planning. AEFI was assigned to BGHMC as the lone level 3 hospital. All point person and heads of particular tasks were required to prepare for the action plan. The objective of the task force was to increase vaccine awareness, confidence, and eventually achieve 70% herd immunity in the province with a population of around 900,000. The teams, including BGHMC, had several simulation exercises. and our AFI response plan was tested. The different processes in microplanning were discussed and agreed. Looking into the preparedness of our hospital for the vaccine rollout, we also did our own microplanning. Vaccination point person was designated. 4 vaccination teams were created. Several simulation exercises were done for the vaccination process, and our infectious disease specialists increased the awareness among our employees by holding several virtual and town hall meetings. BGHMC, as an identified first priority hospital, had a symbolic vaccination campaign which was promoted province-wide. The readiness of the province in terms of cold chain management, vaccination teams, and central vaccination site have increased the awareness in the community. It was even published that the province earmarked ₱1 billion for the purchase of COVID vaccine. Our initial survey in the hospital yielded only 61% approval rate for vaccination. But as we started and continue to campaign and roll out, majority voluntarily submitted themselves. The 5-day campaign period in our hospital yielded an 86% vaccination rate. Are we toward the achievement of herd immunity in our facility? This number is expected to increase as healthcare workers initially deferred are now medically cleared to receive their job. Retrospectively, what could have contributed to this good yield? The presence of our allergologists and IDS emergency medicine during the vaccination day have increased the confidence of employees who were worried and afraid of its side effect. The readiness of response team was visible to address minor and major AEFIs. The visibility of the top management could also contribute. We also provided food, and we had a seamless flow. What should be improved? Scheduling was a challenge. There were idle moments during rollout. QSL is an answer to this. Short notice and unexpected distribution of questionnaires needed by COVID-19 Bakuna Center Registry was a big challenge. Most of the questions were double negatives, creating confusion among vaccinees. The ambivalent vaccinees caused commotion and doubt among those who were already on queue. Our division heads assisted them and addressed this concern. And now, vaccinees with minor AFI should be prepared for their second dose. To be vaccinated is one of the many measures we can take to protect ourselves and others from COVID-19. Protection from COVID-19 is so important, especially for us in the hospital setting and for our colleague frontliners because we know that COVID-19 can cause severe illness or death. We trust and hope that after being fully vaccinated against COVID-19, we may be able to resume doing things that we stopped doing because of the pandemic. But we are still learning how vaccines will affect the spread of COVID-19. We are repeatedly warned by experts that even when we are fully vaccinated, we should keep taking precautions in public places. We should still continue wearing masks and even face shield. As the Center for Disease Control and Prevention shows proof that wearing masks or PPE provides protection against existing COVID-19 infection, the increasing cases of different variants is another threat to our hospital's capacity. As COVID cases and variant increases, a decreased occurrence or zero infection among our healthcare workers should be our goal. While it is still uncertain when the general public would be vaccinated, we can no longer afford to suffer from another health facility outbreak, or worse, witnessing a healthcare worker die from the disease. As the foot soldier in this war, we know that our foe continue to rise and threaten our lives. Our only chance is to protect our healthcare worker with vaccination and PPEs. We are running out of time. Let us be vaccinated. Thank you for your kind attention.
Okay, thank you very much, Ria. That was Dr. Ria Baltazar of Bataan General Hospital and Medical Center, and you've got a lot of fans also on the chat box. Always nice to hear what's going on the ground in the field. Okay, we're going to call everyone into the panel. So Ted Herbosa, Eric Tayag, Anna, Ria, and open your cameras. And before we do that, we know who's in the audience. So Raymond's going to give us a breakdown of who the participants are right now. Go ahead, Raymond.
Thank you, Dr. Susie, and thank you for Director Baltazar's really very practical and realistic presentation. Before we proceed with our Q&A, I'd like to inform you that 51% of our attendees, or at least those who entered and keyed in their answers, are coming in from the National Capital Region, followed by those from Northern and Southern Luzon, and then from Central Luzon, with around 1% hovering po, those attending from outside of the Philippines. We also have our most attended po na
just like the rest
coming in from the nursing field, followed in by those from the medical field po.
Programs.
And then others, we really need to tease out po itong si others po. Maybe we could go on with the Q&A forum, Dr. Susie, before we tackle all the questions here.
Okay, thanks. Thank you very much, Raymond. Okay, so I think let's make this a conversation, but let me ask you a question. Right? Of course, when we look at the rollout, Eric, and it is a plan, and the plan is based on certain assumptions. Okay, so I'm interested in thinking, what do you think could be a disruptor or something that could radically change, in a positive way, could radically change the access to vaccines? So if now we're saying the assumptions are we're not manufacturing, nobody is selling to us, etc., 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 what might be a positive disruptor? Like, frankly, I didn't think we would have vaccines this early in the pandemic. I was one of the kind of, yeah, you really think so? You think in 12 months we'll have a vaccine? But we do have a vaccine, and that was very disruptive. That's changing it. So what do you think could happen that could disrupt this plan in a positive way? And I'll start with Eric, because I'm sure you think about this, Eric, right? What's a scenario where this accelerates?
Okay, one of those that has been good news ay yung bagong bakuna, Janssen, kasi single dose lang ito. So it has its advantage. Kasi single dose lang to, Susie. So yung in terms of storage, kaya lang minus 20 degrees din. Kaya may kailangan balansehin natin. So yan, isang disruptor yan. Pangalawa, ang isang disruptor dito is kung lahat sana yung sinabi ni Dr. Ana kanina, na hindi maiiwanan ang gobyerno sa pagplano. Kasi ganito po yun. Meron tayong pambansang plano. Ang magdi-disrupt po dito ay kung may malinaw na plano po tayo sa baba. Halimbawa po, marami nagtatanong sa amin, anong gagawin namin? Nabakunahan na namin lahat. Lahat, hindi ibig sabihin lahat doon sa facility kundi yung gusto lang magpabakuna pala. Hindi dahil sa nabakunahan lahat kasi iba ayaw na. Di sobrang yung bakuna namin, hindi naman maganda kasi may prinsipyo ho kami. Pag na-deliver sa inyo, hindi pwedeng dadalhin sa ibang lugar. So kailangan magamit na ho yan. So dapat months before, may plano na po kayo na kung ganyan po yung scenario nyo, sino yung mga susunod yung babakunahan na hindi po kayo sumasalungat doon sa mga procedures at guidelines. So halimbawa ako, ospital, at meron ako ganito karaming babakunahan. Halimbawa kay Dr. Ria sa Bataan General Hospital Medical Center. So naubos yung bakuna. Hindi dahil sa wala nang babakuna, kundi ayaw na magpabakuna ng iba. So si Ria, inaasahan namin may plano na may katuwan siyang ospital na may health worker na pwedeng pumunta ngayon sa ospital para magpabakuna. So yung mga ganong detalye, yun ang inaasahan namin at hindi na sana kailangan tanungin pa sa Department of Health. So hindi malinaw kung kami ay may pagkukulang o baka sa matagal na panahon kasi Susi na naging parating umaasa sa DOH na lahat ng guidelines, ihintayin muna kami. So what will disrupt this is that huwag na ho kayong mag-antay kung anong gagawin nyo sa taas sapagkat malinaw naman. So kailangan na magdi-disrupt dito, Susi, ay yung diskarte. Yung discarding hindi po nakakasama.
Yeah.
Next you.
Yeah, Ted, what do you think? What do you think will change the assumption? What assumptions could change this slow, what we're seeing as a slow rollout?
Okay, the slow rollout is actually not because the hospitals chose to vaccinate slowly. The reason for this is the hospital directors didn't decide to vaccinate everyone in the hospital all at once. Because if you do that, many people will have adverse events and you may not have a hospital functioning the following day. So dinistribute nila. So that was a deliberate, and the people are perceiving that this deliberate caution in the rolling out in health workers is the space at which we will go. It is not. What we will see, in fact, I've visited different areas. I visited Imus, Cavite. Tapos na sila sa health workers nila. Ubus na nila. And they're asking me, Dr. Herbosa, pwede bang padala nyo na yung para sa senior namin? Kasi mas konti yung health workers nila. So, this is going to be up to the people that make the policy, which is NITAG and IATF. Sasabihin ba nila sa amin, maghihintay pa kaming matapos yung 1.8 million bago bakunahan yung mga senior? Tapos na kami sa aming healthcare workers. So tapos na kami sa category A. So this is another so that's one. The second one, so yung disjunction between the central decisions and the local implementation. Another one is what I'm foreseeing is all these vaccines that we're ordering from 7 different companies will all converge in the second half of this year. So padating na yung Novavax, padating na yung Sinovac, padating na yung AstraZeneca na in-order ng 39 LGUs. Ang nakikita ko dyan is the current vaccination program at its pace of, let's say, ang sinasabi ko kasi mga 390 vaccinations per day to make 70 million at the end of the year. So that means the whole country dapat each LGU has a lot of vaccination sites. Medyo ang daming criteria sa vaccination center. I think in the US, they're doing drive-through vaccinations. And I visited one that's going to do drive-through in Cavite. So very interesting is how we will roll out when the vaccines start to come here. I don't want them in the cold storage. I want them being injected, and that's going to be the challenge to me. If that's going to be the cause of delay, mas nakakaiyak yon. Kasi yung cause of delay natin ngayon is supplier driven. Wala pang nagsusupply, di ba? Ang masakit dyan pag nag-deliver na sila ng 1 to 2 million a month, 20 million, 30 million, at nandiyan lang sa ating mga storeroom at hindi natin mabigay sa mga tao. To me, that is where we need to adjust. And this is where private sector will kick in. I think the private sector, like what they do in the US, even the pharmacies give the vaccinations. I think we need to have some kind of whole of government in terms of the deployment. Yun ang na-foresee ko, and I think that's going to happen in the 3rd quarter and the 4th quarter of this year.
Ma'am Susie, can you jump in?
Go ahead, Anna, go ahead.
You know what my dream is? I hope a summit on deployment can be conducted. I mean, we're waiting now, diba? The vaccines are not yet here. And even as we wait, I hope that there can be a real discussion about what the plans are and getting the inputs of the LGUs and the private sector on board. Because policy is made by Department of Health, but the hands and feet are LGU and the private sector. And if we don't tell them how to move, what to do, where to go, we're wasting their resources. They're buying vaccines when in fact they should be spending their money on the logistics of deployment. And I think that's such a duplication of efforts that we need to stem as early as possible. And there's still time.
maybe we should be focusing on that.
Good point, Anna. Ria, logistics, magaling sa logistics to si Ria. Ria, what do you think is a disruptor? Anong maaring mangyari na mapabilis natin ito?
I think based on our experience locally here, when we started to roll out our vaccine within our hospital, of course, the concern of Dr. Ted Herbosa about the vaccinators or the team being disrupted during the tour of the campaign period, we have to be realistic in knowing that there's some side effects like flu-like symptoms for the young ones, etc. So they will be down for a day. So for us, it was strategic that the vaccination went well. We targeted at a rate of 400 vaccinae per day. And when we were seeing that there were times that the idle time, we called for the second priority group in the district hospitals, knowing that the allocated vaccines covers them. So even if we are not yet done with the paisa-isa naming mga empleyado because of some reasons, so we already started vaccinating those coming from the second priority group. So even during the first week, we were able to cover the first and second group, the district hospital. So it's more on laying your cards that the importance of collaboration and communication with everyone in the community is very vital for this to work.
Yeah, thank you very much. Thank you very much, Ria. So I think what you're saying is, itong naiinip tayo ngayon, this is because it's early, because we don't have a supply. And it looks like if we use this time to prepare, I think this is what Anna is saying, we use this time to prepare, we have a summit. And what Ria is saying, that we have a plan on the ground, that sort of like you have contingency plans. And Eric has said the same thing. If you have backup plans, it's not like you're waiting for people to tell you what to do, but you do have a plan, then it's not going to be slow, right? Kasi Eric's question was very provocative eh. What year? Talaga naman si Eric, sabi nga ng mga listeners natin, nakakatakot naman yung sinabi.
2021 naman yan, sir.
Tayag,
bawal nang matumagal pa ng 2021.
Ganyan talaga, no? I mean, people say, wow, no, ganda ng presentation ni Eric, pero what year? So anyway, okay. So I think we're gonna take some questions from the audience. I don't know if we have some live questions, but I wanted to ask you another thing. And I'm gonna pick up on what Ria said about a summit. Some kind of a huge, well, difficult to do it on Zoom, right? But it can be, the logistics of it or organizing it could be thought about. What do you think of that, Ted?
Well, let me explain about this. So Anna is with the IATF, so she's with the technical advisor. I'm with the operations group. So I'm with what is called the National Vaccine Operations Center. We work hard at the Vaccine Operations Center because everything has been rolled out. There have been 2 or 3 simulations nationwide. The distribution has been practiced. The vaccine deployment plan that has been approved has already been rolled out to the RTFs. But I agree with her on the summit with the private sector, because what I have seen at the National Vaccine Operations Center is really just the National Vaccine Operations Center with the regional, with the CHDs and with the DILG and the CT and the LGU. So there are several meetings that happen every day there, even Saturday and Sunday. And actually, malinaw, it's very clear to the LGUs or the people who are in charge of vaccine deployment what their role and what they will do. All they said is, we're just waiting for the vaccines. But I agree that this will not be enough, and a summit with the private sector might be necessary as well. I think I agree that... Ano?
Demanding ba?
I think the private sector needs to, because they want, the private sector has been excluded. Unlike in the beginning with the testing and everything, kasama sila, merong T3. I used to attend that because I attended the NTF meetings and I attended the T3 meetings as well. And talagang may tulungan. There was hindi ko nakikita yan dito. Even Red Cross with Senator Gordon has promised to use his 2 million volunteers to help in the vaccination program. Hindi sila kasama dun sa planning at sa meeting. So gusto ko masama sila. So private sector, NGO, the religious organizations, private industries, yung mga industries na gustong-gusto bumili kasi akala nila hindi sila maiiwanan sila. So I agree with Anna's suggestion of a summit that will include the different stakeholders. And the difficult part is, remember, this is an election year. This is an election year. And by October, December, which is when all the vaccines are coming, we have a problem of politicizing the deployment when the vaccines come. And I don't want that. I mean, I really want the people that need to be vaccinated as soon as possible. And the only way we can do that is like the suggestion of Anna, whole of society talaga. The private sector, the NGO, the religious, the universities, the students can be volunteers. Universities, the SUCs, and everything. We can use all of this so that we can vaccinate the most number of people. Nagawa nila to sa Israel. So I don't see why we can't do it here in the Philippines.
Then sabi ni Ana next week na daw. Eh di i-host na UP, di ba?
Kaya yan ni sir. Next week.
Sige. Then mag-summit din tayo dito. Let's call the religious. Let's call everyone that has been excluded in the National Vaccine Operations Center. Yun ang tawagin natin and let's hear them out, di ba?
May 10,000 capacity na yung TVUP plus Eric Tayag sources. Eric, what do you think of that? I mean,
unang-una, oo, hindi naman out of the loop yung private sector kasi may sariling weekly meeting kami sa private sector. Okay. Yung involvement nila, ang tingin ko naman dito ay sino yung mga iimbitahin kasi limitado lang tayo eh. Ang pinakaano kasi dito, kung narinig nyo si Ria, nasa baba ang sikreto yung gagawin nila doon. Kasi yung mga guidelines nilabas na natin. So, nasa baba, sino mga dapat kumausap doon? Katulad ngayon, sinasabi nila hindi naman kami iniimbita, naghihintay kami ng imbitasyon. Hindi yun ang dapat nating gawin. Ang tanong natin, ano bang pwede kong maiambag? Anong pwede kong gawin? So, halimbawa, ikaw may resources, ba't hindi mo puntahan na yung mayor, yung director ng ospital? O paano kami makakatulong? Ito resources ko. Kasi po kung mag-aantay lang tayong makalabit tayo, maimbita at para magbigay ng pananaw, that is not going, it's going to happen but wala. Talo na naman tayo. Kasi alam mo, Susie, sa tagal ng panahon ng paninilbihan natin, if we used to do yung dati nating ginagawa, ay wala pong mangyayari po yan. Okay. Yun po ang aking pananaw. At lahat po yan nandun sa baba, yun ang pinaka-key para na sa ganun ay umandar ito. So ang ano lang natin, sa taas naman, ang dapat agapan, siguraduhin pag sinabing 5 milyon ang darating ngayon, 5 milyon. At magiging mahirap po kasi sa amin at kami ay napunana dyan, may sasabihin kaming ganito tapos aatras at hihingi ng sorry at dahil ganito lang pala. So ngayon po ay nagiging maingat kami para na sa ganon ay yung tiwala ay nandiyan pa rin po.
Yeah, thanks Eric. I mean, I agree with you na we shouldn't wait, but I'll just put on my kind of like what do we call it, a WHO hat, right? Sometimes it helps to see, like, seeing what Ria has done, isn't it? Biglang magkaka-idea ka eh. No, I think the thing about the pandemic is I don't think people really need guidance on what they're going to do 1, 2, 3, 4, 5. But maybe they need to share and to see examples of how to do things differently. But I do agree with you na hindi dapat nag-aantay, no? I mean, that's what kills us, eh, di ba? Yung nag-aantay, sinabi kasi ganito, ganyan. Kailangan kalahati, no? Merong kusa, pero meron din tayong binibigyan ng mga halimbawa. Halimbawa, pwedeng ganito. And I think to Ted's point on politicizing it, you know what? I think right now, if our political leaders all support vaccination, I think it's a good thing. How we just make sure that it's not used for specific agendas. That's the challenge, and that's why if we get everybody involved in a summit, then may kanya-kanyang pado yan. Ano? There are a lot of people who are listening in this webinar who are private practitioners. We've seen this every week. Now, people who are working in their own clinics, they're doing their own thing. They're not part of the big hospitals. They're not part of the government, but they do want to be engaged. So I think it's something to talk about, to think about. How do we gather? And yeah, maybe we should do a summit with TVUP, but that's Ted's call. Okay. So Raymond, do we have something from the audience?
Yes, we have two. One of them is, well, not a stranger to us. She's Dr. Raimundo. Maybe call on Dr. Raimundo for her live question.
Thank you, Doc Raymond. Good afternoon, doctors, Doc Eric, Ria, Anna, Ted, Charlotte, also Doc Susie and Doc Raymond. So thank you for allowing me to ask my question live, but I don't know if we have time. But my question had to do with the naiinip na sectors with regards vaccine procurement. So my question is, how would you advise, or what advice would you give to these sectors, private sectors, non-government, HEIs, LGUs, who are interested in procuring vaccines to expedite the protection of their stakeholders, their employees, their staff, their students? With regards general processes for procurement, funding, minimum requirements for procurement, timelines, turnaround, and whom to talk to. And also, how would you think this would impact either positively or negatively with the overall initiative of the government? But I would also like to say that I really totally agree with the summit plans. I think what we need is a structured, systematic, and harmonized plan that involves both government and private sectors. Thank you po.
Okay. Thank you for asking the question. Alam mo, kaya nagkakaroon ng ganung mga request sapagkat naiinip na. So, kailangan siguro may naipangako sila sa kanilang constituents na kung itong mga priority ito at baka kulangin yung hindi sapat ang pambili o yung para makuha yung mga vaccine, gagawa kami ng paraan at isa sa ambag namin, bibili na kami. So the process is, you have to submit a letter of intent, okay, to Secretary Galvez, the vaccine czar. In that letter of intent, you have to state the details of your request, like ilan ang bibili nyo, ano yung preferred yung bakuna, kailan kayo magbabakuna, kanino nyo ibabakuna yan, at mas maganda kung may listahan kayo kung sino yung mga babakunahan. So yan po yung proseso that pinaiiral po ngayon. So kung may gano'n po kayong plano, balak, gagawin nyo po yan. Kaya lang narinig ko nga si Ana na may mixed feeling dito. Ako man, sapagkat provide naman lahat yung bakuna. So para mag-isip yung mga, nagulat nga kami na yung mga local government nag-a-announce na bibili kami ng 1 billion pesos. Bibili kami ng 100 million. Parang naging auction, ano? Pero naintindihan namin sila kung saan nang gagaling. Kasi yung mga bakunang bibili nila ay siguro wala dun sa nilista namin sa priority. Baka hanapan sila kung paano naman kami. So, ganun nangyayari. So, letter of intent ang kailangan po. At kailangan mapadala na po yan sapagkat marami po nakapila.
Can I just add something to this discussion, maybe a different aspect? Siguro yung, again, playing on yung question of naiinip ka na ba? Siguro yung perception kasi is kung meron akong order with some supplier, I can control the timeline kung kailan darating yung bakunang gusto kong makuha. And even as national government says na huwag kayong mag-alala, bibigyan kayo, yung question of kailan. Yun ang hindi masagot ng malinaw kasi nga, syempre, we are at the mercy of manufacturers. So I think we need to recognize that aspect also. And ang hirap kasing magsabi na habaan nyo pa yung pasensya ninyo kung walang klarong pa. I think yun yung mga kailangan nating tignan para ma-address naman yung legitimate concerns ng mga tao.
Raymond, did we have one more question?
Yes, it's a second upvoted question. It comes from Dr. Rain Sindayan. Dr. Rain. Dr. Rain, are you in the call? We're not seeing him, Dr. Susie.
Okay. So, okay, I think in the interest of time, because we're at the top of the hour. Okay, there's Dr. Rain. Please go ahead. Open your camera.
Hi. Good afternoon. I'm not a doctor. I'm a researcher by profession. My main question would really be, how do we assess our pace of vaccination? Primarily, if we compare it against our neighbors, number one, and then number two, if we can try to, if we can try to standardize our comparison. For example, for our neighbors or those countries in the same economic classification. And then I heard earlier our concern about politicizing the vaccine rollout come October. So are we concerned about that? Are we trying to beat the clock on that? Yeah, that's basically it.
Okay. Thank you so much. There are metrics about this so that we can have comparisons like the number of doses, vaccine doses that have been administered per 100 population. So so you can actually make comparisons instead of just reporting the number of doses that have been administered, although it's also a metric, the number of the first doses that have been administered and fully vaccinated. And so these metrics are what we're supposed to gather. But right now, we're zero on the fully immunized. We've just started. And we have over 215,000 who have received the first dose. So that means we are at 0.2 per 100 population, whereas Israel is already over 110 per 100 population. And so we're lagging behind, not because we're lagging behind. We don't have the vaccines. And hopefully when they arrive, we will be at par with other countries that have deployed the vaccine. So there are metrics we can actually compare, but the most important one would include, of course, how many have been fully immunized. Thank you.
Thank you, Eric. Okay, we're going to look at the answers to the poll questions. So Raymond, take over.
Thank you, Dr. Susie. For our first question, we have 4 questions for this one. I'll just read off the list and hope our resource persons can just jump in and answer the questions. The projected number of individuals in the Philippines who will receive the COVID-19 vaccine in 2021 is 10 million, 30 million, or 50 million?
Okay, there have been announcements that we are set to have over 160 million doses, and we're setting it to just half. So the projected number of individuals at the end of the year is placed at just 30 million or more. But of course, this is projected. It's up to us that this really happened.
Thank you, Director Tayag. The next question reads, vaccine coverage is the number of those who got vaccinated over eligible population, the number of those vaccinated over total population, or the number of vaccinated over those who did not get vaccinated?
Okay, definitely not the number of those who got vaccinated over those who did not get vaccinated. When the eligible population is equivalent to the total population, then they are similar. Right now, children younger than 18 are not considered as eligible population. But in the future, because there are clinical trials that will already include them, so there will be universal vaccination for every age group, then we prefer the number of those who got vaccination over the total population. That's why the metric is the number of doses administered per 100 population.
Thank you, Dr. Eric. Second to the last question, how soon do you get antibody response after the second dose?
Anna can have that.
I'm sorry,
Anna?
I was reading the questions in the chat.
Okay,
Can you
okay.
repeat?
Question
Sorry,
number
I'm
5,
paying
Dr.
attention.
Anna. Question number 5, Dr. Anna reads, how soon do you get the antibody response after the second dose? Is it 7 days, 14 days, or 21 days?
Well, actually, it depends on the studies. No, most of them started counting cases 14 to 21 days after the second dose. So that's the assumed range of protection.
14 days, 2 weeks.
Thank you, Dr. Anna. And perhaps you could also take the last question. It reads, how long are you protected from COVID-19 after vaccination? Is it 6 months, 1 year, 3 years, or not known?
The answer there is not known. No? The data that we're looking at right now with respect to efficacy only talks about protection for moderate to severe disease. There's no data to tell us, to inform us about duration of protection currently.
Thank you, Dr. Anna.
Okay, so let's do go Raymond, go with the evaluation.
Okay, I think we go straight to the evaluation. In the interest of time, I'll just read the questions here. This for our first timers, this how we do it at the end of each panel discussion. Number 1 reads, the panelists demonstrated thorough knowledge of the topic. It's a lighted scale. Number 2, the panelists were prepared and organized. Number 3, the panelists spoke clearly and audibly. Number 4, the panelists used appropriate language with technical medical jargons adequately explained. And lastly, the panelists contributed to new perspectives and knowledge on managing various key COVID-19 health issues. So please key in your answers. We still have 1,600 attendees in this Zoom webinar as we move on to the last word or messages from our panelists.
Okay, so you have a minute or so to just give a message to our audience na naiinip. We'll start with Ria. Ria, ikaw muna. Last few words.
Yeah, as I have started before my presentation, my focus is on really convincing all the healthcare workers to be vaccinated. We should avail of whatever is available because it has undergone studies and secured emergency authorization authority. So let's trust and be confident in its use because it offers some degree of protection. We are the foot soldier against this war, and we cannot afford again to have some healthcare workers succumb to this infection. So magandang hapon at let's be keep wearing our mask and face shield because it still offers protection.
Thank you. Anna.
Maybe I'd like to go back once again to the question that this webinar poses, no, naiinip ka na ba? And natutuwa ako na naiinip ang mga tao kasi for me, it tells me that people really want to be vaccinated. And it's our job, no, in our role in public health right now to make sure that that question, that need is going to be answered in the most efficient way possible.
Thank you. Eric.
Thank you, Susie. Okay, thank you, Anna, Ria, and everyone else in this webinar. This has been said again and again, no one will be safe until everyone is safe. Yan po ang ating slogan. At pangalawa po yung ating solidarity. This is not the time to have contrary opinions just because you want to be the more talented or the more knowing. Nagpapasalamat ako kay Ana sa kanyang mga interviews na papaliwanag niya yung mga basic knowledge na kailangan malaman ng mga kababayan natin. Pero ilang Ana meron, ilang Eric, ilang Susie, ilang Dr. Ted. Lahat po tayo sa webinar, nanood po kayo ngayon at sa nakalipas na maraming linggo dito po sa Stop COVID-19 Deaths. Hindi po ibig sabihin na parati po tayong sumasali dito, nakakatayang informasyon, natutuwa po kayo sa amin na kayo ay natututo. Subalit, more than that, ang hinihingi po namin sa inyo ay ano magagawa ko pagkatapos nitong webinar? Yung mga sinabi ni na Dr. Tayag ng mga panelists, kailangan natin mag-isip ng malalim sapagkat hindi lamang to simpleng webinar, nakasalalay po rito ang ating kinabukasan. Maraming salamat po.
Thank you very much, Eric. Ted?
Well, for me, I know naiinip kayo, no? I think that's the sentiment. Pero as someone with an orchestra seat on how the national government is deploying the vaccines, I can tell you there are so many people from the Department of Health, the DILG, the PNP, the LGUs, working night and day, literally working night and day to make sure the vaccines get to the people that need them. I have some good news for you. This morning, the Philippine FDA approved the Sputnik 5 or the Gamaleya Russian vaccine. So it seems, although we're fighting out for the Western vaccines, it seems that the other vaccines are coming. And as you know, even the supply agreement with India has been signed regarding the Novavax vaccine from the Serum Institute. So that's going to be delivered as soon as they get their EUA. I know they have applied in our FDA. So palagay ko, if you ask me, yung maghihintay na lang kayo bandang mga April or May, my optimistic estimate will be May. The public will start to get their jabs and their vaccinations. Hindi na matagal yon, mag-Holy Week lang tayo, tapos konting stay at home, tapos pag tinawag na kayo, pila na kayo dun sa vaccination center. Yun lang, maraming salamat.
Thank you very much, Ted. We've got the Dean of the UP College of Medicine, Charlotte Chiong, to give our brief summary and closing remarks. Charlotte, go ahead.
Well, my video's not working, no? So I'll just give the. Opened up with a very good and candid conversation between Ted Herbosa and of course Dr. Susie, you know. And it started with some background. Way back in 2000, we already wanted a vaccine production with the biological product services. And we also, of course, wanted a CDC. And even though this did not happen even after 20 years, I think this pandemic has taught us that there's really urgency in setting up all this. Our main speaker, Dr. Enrique Tayag, gave us really a comprehensive and honest, yung tinatawag na real talk, talagang walang bolahan na pag-uusap tungkol sa vaccine sourcing, deployment programs that are envisioned by the national task forces and the vaccine experts. What is good about the talk of is that he laid out the prioritization, the sub-prioritization, our performance targets, kailan ba natin to ina-aspire na magawa. So that's very good in that we now have a broader and comprehensive view of how these vaccines are going to be deployed and the other issues that might come and how we compare with other countries. Dr. Ong Lim gave scenarios. Bakit nga ba naiinip? Bakit ba naiinip? Dahil convinced na itong vaccines are really going to work? O naiinip ba dahil doon sa second dose? O naiinip ba dahil yung mga ibang doktor ay hindi pa nababakunahan, the senior citizens, other sectors of the population? So I'd like to thank her for the candid reactions on the presentation of Dr. Tayag. And on a positive note, she pointed out that civic societies, organizations, private organizations even have already made initiatives to access these vaccines. And there should be a very clear and honest connections between the public sector and government and the private sector on how we can help each other in order to make this deployment as effective as possible with a very clear transparency for all the different sectors of the population. So palagay ko nga ay napapanahon na para talaga magsama-sama at mag-usap-usap in a public setting where people can really discuss the issues. Tama ang sinabi ni Dr. Ong Lim na kaya importante that these vaccines get deployed as early as possible is because we have a reproduction number that can go up or down. And the herd immunity that we're speaking of, whether it's 70% or 80%, will really depend on the reproduction number that's actually prevalent at the time. And we've seen that variants can actually increase transmissibility. There are certain variants that can also cause more mortality, like the Brazil variant. We have now our own variant. Nandito tayo sa world map of COVID-19 variants in the world, and this is the P3 variant. And we are still doing studies on whether this P3 variant will be more prevalent in our population, and whether the Sinovac or whether the AstraZeneca vaccines or even the upcoming vaccines like Sputnik will have the same efficacy against the more prevalent variants in our population. So we need studies. We need to do more research regarding this. We have yet to see the neutralizing antibodies that we're able to produce after one dose, single dose, with the different vaccines that are available in our country. So these are all challenges for the academe or for the researchers in our country. Dr. Ria Baltazar, who's the director of Bataan General Hospital and Medical Center, who I've never met, but I've been impressed because I also have the Universal Newborn Hearing Screening Program, and I know that Bataan General Hospital is one of the key implementers of the Universal Hearing Screening Law. Gave us a clear view of the prioritization scheme and how they're able to do this in Bataan. Vaccination, as she said, is a race against time, and that we need to be mindful that there could be health facility outbreaks that can affect our ability to wage a successful war against COVID-19. So setting up the laboratory, the testing facilities, the electronic medical record system of interconnecting different facilities is very important so that we are able to accomplish the vaccination acceptance that is really needed. And we need all specialties like IDS and radiologists to be there, top management to be there visibly so that the ambivalence regarding vaccines can actually be managed. She also rightly pointed out the need for all of us to receive the vaccines as soon as possible, once available to our group, according to the prioritization list that was set up by the Department of Health. No? Tinanong ni Susie, ano ba yung mga disruptors na pwede? I think my take on this is that probably we will still have the ability to develop our at-home saliva test. Nung time ho ng mga March pa lang, end of March, I already talked to NIA. Sabi ko, this nasopharyngeal swab is not really very acceptable. Maraming mga variation in the test results. Baka pwedeng saliva test na lang. And I am very happy that we were able to work with the Philippine Red Cross on this. And we are looking now at our ITF validating this. And perhaps an at-home saliva test can help in the T3, no? The treat, the test, the trace and treat algorithm that can actually help also our vaccination program. Initiatives and out-of-the-box solutions that are needed in order to make the rollout as efficient as possible will have to be still analyzed, and there should be distribution among all the healthcare workers. I would like to see PMA, to the Philippine Medical Association, to be more active in this, especially for those who are in the doctors practicing in standalone centers, no, because I think there's a feeling that they have been left out. So maybe we should look at that as well, because they're also a very potent force of our healthcare workforce. The bakuna centers that have to be set up really well with the help of private sector, maybe also. And of course, having all the other healthcare workers like pharmacists and workers in the LGU to be involved in order to increase our vaccinations per day. No? Nakikita ko sa dyaryo, lahat ng mga business organizations are taking their vaccines. Filipino-Chinese Chamber of Commerce announcing, coming up with their own master list. And I think that's good. And they just have to, sabi nga po ni Dr. Enrique Tayag, just write a letter to Secretary Galvez, and we should be able to have that conversation, be able to help. Harnessing technology like geospatial artificial algorithms that might help. I was a judge in one of the contests in the UP Engineering, and the young people po are able to come up with software solutions for this. Vaccinia, I saw that, which takes into consideration geospatial artificial intelligence solutions that might be used by our government or even our LGU. So we're all in this together. Ho. If it's a war, laban po natin lahat ito. So let us stop COVID deaths. Thank you all again to Dr. EVP Ted Herbosa, to TVUP for this webinar, and of course our main speaker, Dr. Enrique Tayag, our host, Dr. Susan Pineda and Dr. Raymond Sarmiento, our reactors, Dr. Ong Lim and Dr. Ria Baltazar, the team at TVUP. Naiinip na po tayong lahat, pero I could say that the uncertainty of kailan nga ba darating yan? Tingnan po natin the broader picture. The uncertainty of when will need to encompass a broader plan of how the next normal will be for our country. We should have to produce our own testing capacity. We should have the ability to also produce our own surveillance mechanisms. We have to be able to produce our own vaccines for our vaccine sufficiency and resiliency. At ito po ay hamon na hindi natatapos kahit na po tapos na po itong pandemya, dahil ito po ay matatapos. Naiinip na kayo pero darating po tayo dyan. Matatapos po ang pandemya. Natapos po ang pandemya noon, lalo po ngayon matatapos po ito. Let's act together, let's help each other, let's have a whole of society approach. Pati po yung mga bata, isama na po natin yung mga matatalinong bata sa ating populasyon. Huwag po natin sila iwanan, isama po natin sila sa conversation na ito. Maraming salamat po.
Thank you very much. That's Charlotte Chiong, the Dean of the College of Medicine of the University of the Philippines. Always very inspiring, Charlotte. And
thank you.
Very visionary. All right. So thank you very much to our audience for being with us today. Next week, okay, magandang topic. The topic is my LGU prepared for COVID-19 vaccine rollout? Now, we're going to have the UP Resilience Institute giving us an idea of where we're seeing a lot of increase in COVID-19, but we're trying to get 2 local government heads. We can't say who yet because they haven't said yes yet. But we're planning to get to have some LGU perspectives, and yeah, handa na ba LGU nyo, no? And siguro magandang malaman kung ano ang paghahanda na ginagawa. We also have somebody from the private sector. So over to you, Raymond.
So thank you, everyone. Thank you for another lively discussion. Thank you also for that inspirational takeaway message from our Dean of College of Medicine, Dean Charlotte Chiong. Gaya po na nasabi po ni Dr. Susie, makita-kita po tayo ulit next week. We also have, ito po confirmed na, very, very special person who is part of the, she heads the National Vaccine Operations Center, none other than Undersecretary Mirna Kabutay, who will be giving the opening remarks for next week. But we really hope that those we have invited from the local government units will be able to attend and give their presentations on how they have been preparing for the LGU vaccination program rollout. In front of you, you see po the answers for the questions for our fun quiz or poll. So maraming salamat po sa mga sumagot at nakasagot po dito po sa poll na ito. Thank you again for those who are watching. Maaari niyo po itong mapanood ulit sa playback sa YouTube channel ng TVUP. Also in Facebook din po, mapapanood niyo rin po itong episode na ito. So maraming salamat po ulit. Magkita po tayo ulit next week, Friday, March 26 from 12 to 2 p.m. It's a date.
Together, we can stop COVID deaths.
So keep safe, keep healthy, and see you online.
The enemy remains unseen. I'll keep your hand in mine. Let's say a prayer one more time. I know you long for home, but I am here, you're not alone. I'll stay with you until the coast is clear. The others pain before my fears, the others laugh before my tears. But right behind the mask, I look into myself and ask, do I have strength to carry on? Oh God, how long must this go on? I need you here to keep me strong. I'm here to hold the line. I'll keep my word until my time. Just look into my eyes and say his name to realize it's fine to be afraid. Just hold on to the word he gave. This time will come to pass, 'cause this salvation's made to last. He'll carry you to see the break of day. The others pain before my fears, the others vows before my tears. But right behind the mask, I look into myself and ask, do I have strength to carry on? But God, how long must this go on? I need you here to keep me strong. I'm here to hold the line. I'll keep my word until my time. The others pain before my fears, the others laughs before my tears. But right behind the mask, I look into myself and ask, do I have strength to carry on? But God, how long must this go on? I need you here to keep me strong. I'll keep my word, your word is mine. The others pain before my fears, pushing on despite the tears. Please take us through another day. Just hold my hand, and I will hold the line. I will hold